Hi, this is Claudine from the Murdoch Children's Research Institute. I'm talking today about quantitative gait analysis in children with Prader-Willi using a wearable sensor. So gait deviations are very common in children with neurodevelopmental disorders. For instance, we see toe walking in autism, crouch gait in Angelman syndrome, gait apraxia in Rett syndrome, and flat feet in Prader-Willi syndrome. These are often overlapping across neurodevelopmental disorders, and they range in severity. And these arise because of a combination of the following: neurological, cognitive, or psychiatric phenotypes, hypertonia, laxicity or flat feet, and low muscle strength or pain or stiffness in the body. It's important to understand the downstream clinical impacts of a gait deviation. Direct impacts may include poor balance, pain, stiffness, and a range of other issues. And these are tricky to treat, especially in children with neurodevelopmental disorders, so early diagnosis is important. Downstream indirect impacts can include impacts to cardiovascular health, obesity, mental health, social participation, and impacts over time to muscle mass and bone mineral density. What do we know about gait in Prader-Willi? Well, children with Prader-Willi walk late. More than half are walking between 16 and 24 months, and close to 30% report walking age as after 3 years of age, which is significant. We also know that adults with Prader-Willi have a cautious and slow walking style. Reports have also described atypical symmetry and stability issues and difficulties with gait initiation and termination. Our team's work is very much about expanding the knowledge base around gait in children with neurodevelopmental disorders such as Prader-Willi. We conduct our studies using small inertial sensors. We really like these sensors because they provide high quality objective results. They're also much more inclusive than traditional methods, and this leads to less bias in research. And finally, they pave the way to hybrid and decentralized trials where assessments may occur in the child's home setting or a familiar environment. And here you can see 2 children from our studies who have Prader-Willi. The sensors are inserted into the shoe either side or in the shoelaces, and then we ask the child to take a walk with the assessor, and all the data is exported later. We also collect some data on cognition and behaviour so we can understand how this is correlated with movement during gait. We've tested 10 children with Prader-Willi, but we really want a larger sample size. Participation requires about 30 minutes of your time, plus travel to the Royal Children's Hospital. If you'd like to participate, the study information is on the PWRF Australia website under clinical trials, or you can contact me directly. Thanks for your time.